just going to see if we can hold in for yours, and then you can see if you can ask questions. All right, we have a couple more people. All right, we got a bunch of people in here. Okay. So go for it, Sierra.
Okay. Hi, everybody. Thank you so much for joining us on this beautiful Tuesday evening here in Ocala, Florida, virtually. So my name is Sierra Mahoney. I am a physician associate here at Midstate Skin Institute. And I am accompanied by my beautiful medical assistant, Ms. Kaylee. So yeah, thanks for all, to all of you for joining us. We have a list of some questions that people have sent in that we were going to go ahead and make sure we get answered. And then if anyone else has additional questions, feel free to just kind of comment below and we'll try to get everybody's questions answered. So thanks again.
All right. The first question that we have is, what does skin cancer actually look like, Sierra?
Yeah, so skin cancer is one of my favorite topics. So this is a great question. I went ahead and I actually gathered a little photo to show the 3 most common types of skin cancer. Thank you. Okay, so hopefully everybody can see my screen here. Starting on this side, this is a basal cell carcinoma. This was classically known as the most common type of skin cancer. Basal cells tend to present in sun-exposed areas like the head, neck, arms. They are a very slow-growing type of skin cancer most of the time. We consider this particular type of skin cancer to be a little bit more benign than my other 2 types of skin cancers listed here. Second, we have squamous cell, which is kind of quickly becoming the most common type of skin cancer. Squamous cells also are basically caused from years of sun exposure. So most commonly found in sun-exposed areas like the head, neck, the arms. Basal cells here tend to have kind of a pearly pink color, and they're a little more slow growing. They sometimes can be asymptomatic, meaning they don't really always present with any symptoms, versus squamous cells can actually appear pretty rapidly. They tend to look more like a little volcano with kind of a crusty central core. And these ones can actually be quite painful or even itchy when they first appear. So that can sometimes be a sign. And then lastly, we have melanoma here. This is considered to be the most deadly or the most dangerous type of skin cancer. Luckily, we don't see this particular type of skin cancer nearly as often as we do the basal and the squamous cell. But this one, if you have it, we want to get it caught and treated early. Because if we let this go too long, this one can certainly be deadly and cause more problems. So one other thing here that I wanted to take a brief moment to discuss were the A, B, C, D, E's of melanoma. So I'll try to zoom in on this photo here. But whenever we're looking for melanoma, we kind of go through this mnemonic, which can help us detect or catch melanomas early. A stands for asymmetry. And what that means is if you were to cut a mole in half, one half doesn't quite look like the other half. B stands for borders. Anything that's got kind of an irregular shape usually gives us pause. Normal healthy moles should have a really nice round circle color or shape to them. So anything with an irregular shape, that would be, give us pause for melanoma. C stands for color. So anything that has blacks, pinks, grays, blues, that's not always a good sign. We really want to see moles be a solid color throughout. D stands for diameter. So normally the larger the mole, the more concerning. And lastly, E stands for evolution. And this is why we take a lot of photographs in dermatology, because if a mole starts out looking one way and over time kind of morphs or evolves into something different, that can also be a sign of melanoma. So that's something we really want to look for whenever you come in for a skin check. So,
Thank you, Sierra. All right. Another question that is very common is why do I suddenly have all these weird brown spots?
oh, yes, this is a great question. So, luckily, despite going over skin cancers a moment ago, luckily, most of the spots on our body are completely benign. But just because they're benign does not mean they're not bothersome to people. So, two of the most common types of brown spots we see. One are called seborrheic keratoses, and these tend to present as kind of these little warty looking growths. We sometimes call them barnacles or wisdom spots. And they almost look like little cauliflower heads, and those can be quite itchy, very unsightly for some people. And we think, age, genetics, sun exposure all kind of plays a role in their development. And the other very common brown spot that we see are what are called lentigos. And those are what we call sunspots or liver spots. And those are the brown kind of freckles, if you will, that present in sun exposed areas like the shoulders or the legs. And they are caused just from years of fun in the sun, but luckily they are benign. So,
All right. And then the next question is what's the most common skin condition that you see?
yeah, so I would say besides skin cancers, we also deal with rashes in dermatology. And we see eczema and psoriasis. Those are two very common rashes that we see. And we also see quite a bit of acne. So, great question. Did we have some live questions? Yeah, okay, wonderful.
All right. One question that someone wanted to ask was what advantages in dermatology are you most excited about?
Okay, that's another great question. So, as I mentioned just a moment ago, we see quite a bit of eczema and psoriasis. Those are two most common type of rashes that we deal with, and there's a ton of money and research being pooled into those two conditions. So it seems like almost every month there's some sort of new drug coming to market to treat both of those rashes. And these treatments are very safe, very effective to a point where even if somebody has covered 100% body surface area, a couple months on these medications and their skin is completely clear. You would never even know they had a rash. So it's just pretty remarkable. So.
Okay. And then another question is why is my skin itchy all the time, even though there is no visible rash?
Yes. So, an itch without a rash present, the medical term for that is pruritus, and that can be one of the toughest conditions to treat in dermatology. Back in the day when somebody would come in with itchy skin and no rash, it was kind of like, oh gosh, what do we do? But just like with eczema and psoriasis, itchy skin, we now have a lot of great treatment options for. People can be itchy for a variety of reasons. Sometimes it's as simple as dry skin. Dry skin can make people very, very itchy. And as we age, our skin barrier isn't quite as strong as it once was. So moisture kind of gets sucked from our skin, leaving you with dry, cracked, scaly, itchy, flaky skin. But the thing is itchy skin with no rash present can sometimes be a sign of something a little bit more concerning. So whenever a patient comes to see me with an itchy skin with no rash, it's always important that we, check some lab work just to make sure there's nothing going on internally that could be contributing to their itchy skin. Because sometimes things like thyroid problems or cancers, those sometimes can also be associated with an itch with no rash. Um, and also medications, vitamins, supplements, over the counter medicines, prescription medications. That can also be a very common culprit for itch with no rash. So, yeah, it requires a bit of a workup whenever somebody comes in. There can be lots of different reasons for it, but it's a challenge I at least very much enjoy. So,
Okay, and then one of our viewers has a question that they want you to answer, Sierra.
Okay.
Are you able to give us some more detail and information about the pre-cancer cream?
Yes, so this is an excellent question. This is what I spend a lot of my day talking about. So, precancers are little rough, scaly bits that present in sun exposed areas like the head, neck, and arms. If you rub them just right, they can almost feel like a little shard of glass in the skin. They're kind of like these dry bits of skin that never really get better. They don't really respond to moisturizer. And we call them precancers, but the technical term is an actinic keratosis. And if left untreated, this can be a precursor to squamous cell, which was the second skin cancer I showed at the beginning of our session. And so we try to kind of treat these before they have a chance to grow a root and become a squamous cell. Now, normally, you don't just have one precancer. Normally, you have several in an area. So, when it comes to treatment, one of the most effective treatments is the precancer cream, which is what this lovely viewer was referring to. So, one of the most common precancer creams we use is something called fluorouracil. And basically, it's a chemotherapy agent that basically destroys precancerous or even cancerous cells of the skin. So when you apply it, and then you rub it on just like you would a normal cream or lotion, typically anywhere between 7 to 14 days. Depending on how many precancers, the surface area that you're covering, and the version of the cream you're using. And basically, it almost acts as like a little cancer detector. That particular chemotherapy agent targets those precancer cells, and it turns them red, scabby, scaly, and then sort of peels them off like a chemical peel. So I always tell patients you should expect a pretty vigorous sunburn like reaction. Your skin gets red, scaly, angry. And that's the medicine killing off the cancerous cells. And then it just kind of peels off. So when you're done with the treatment, your skin should be really nice and smooth. It shouldn't be rough, crusty, scaly anymore. I kind of compare it to like a chemical peel. So it's not that great while you're using it. Some people have very vigorous reactions, but if you can push through the treatment, give your body time to heal, normally the end result is well worth it. So.
Okay, and then in addition to that question,
Yeah.
someone wants to know, are there any other side effects caused from the precancer cream?
Yeah, that's another great question. So, most of the time, itching, stinging, burning, those are very common side effects. Now, if we're having somebody use the cream on a large surface area, sometimes you can get a little bit of systemic absorption. So, I have had patients who have complained of flu like symptoms where they just kind of feel tired and sluggish, maybe even a little queasy or nauseous. Really, the side effects from that cream should not go beyond that, and even those systemic symptoms are very rare. But that would be kind of on the extreme end of the spectrum. You might feel like a little under the weather, but by far the most common side effects is the itching, burning, stinging. That is to be expected. So,
Okay. And then another viewer has a question. They are wanting to know how much sun exposure is considered too much. Do I need to avoid the sun entirely or have sunscreen on as much as possible? Can someone be too paranoid about sun exposure?
that's an excellent question. And it's one that I don't have a completely definitive answer to. Sun exposure, UV radiation, it's a very complex topic. Some of us, like Miss Kaylee here, she's kind of got a nice sort of golden color to her skin compared to somebody like me who's pasty white. So somebody like me, even 5 minutes in the sun, and I can literally feel my skin burning. I don't have a lot of melanin, which is kind of your body's natural defense against sun exposure. It's what gives you that nice tan color. So for me, almost any sun is too much sun. So I always make sure, I go out with my sun protective gear, my big dorky wide brimmed hat, my sun shirts, and
She-
definitely sunscreen.
She also wears gloves too.
I do. I have driving gloves that protect my hands from the UV radiation.
Which is very important.
Yes, but another point that I like to make to patients is, we live in Florida, we love the sun. I don't want to deprive people from that joy, but I do tell people if you are going to be outside, try to avoid peak hours, usually between 10 and 4, where the sun and the UV radiation is just super intense. And I do tell people wear sunscreen. We really recommend an SPF of 30 or above. And I tell people try to reapply every hour. The bottle will say every 80 to 120 minutes. And the one other little plug I like to put in is that you can still tan even with sunscreen, okay? I've had 2 patients this week that were beautiful golden brown, but they didn't have a speck of skin cancer on their bodies. And that's because they are religious about their sunscreen. So that's just another important point. You can still get that nice tan even with sunscreen. So
Okay.
Yeah.
And then another viewer has a question. Are there any over-the-counter products to effectively treat seborrheic keratosis or lentigos?
another excellent question. So no. uh, let me rephrase. These benign but very annoying spots are difficult to treat. In clinic, in our practice, we tend to use a cold liquid nitrogen spray, which basically induces frostbites to the area or frostbite to the area, so they kind of swell up and peel off. But in certain areas like the face, it hurts when they peel off. It can leave white scars behind. So some alternative treatment options. If you wanted to try something at home, I would recommend a cream that's got some sort of urea or salicylic acid in it. Because that kind of very delicate acid over time, if the spots are thin enough, can start to just kind of gently exfoliate them off. But I will totally warn people that it doesn't work great, but that is a very safe at home treatment you could try. The other thing I'll sometimes do for patients is I can have a little medication compounded where they can paint it on these little benign, annoying spots at night. And it's the same kind of idea that slowly over time, it sort of irritates the area so that it gently peels off. But there's no perfect way to get rid of these guys. They're quite pesky and usually require long treatment durations or multiple sessions before they go away. So, great question.
Okay. And then back to when we were talking about those gloves that you wear.
Yes.
Someone is wondering where they can purchase those gloves.
Oh, I'm thrilled. A person after my own heart. Okay. So I typed in UV protective gloves on Amazon, and you would not believe the results that popped up. There are ones that are just wrist high, ones that go up the whole arm. But Amazon has it all. So
Okay. And then someone said sunscreen is toxic. Is that true or
that's
false?
another great question. So yeah, there's a lot of hoopla surrounding sunscreen these days. So there has been some sort of conflicting data and a lot of news media attention surrounding sunscreens. And do the chemicals in sunscreens cause cancer or can they be toxic? To which I usually respond, the fumes you breathe from your car exhaust, the cigarette smoke, that we are exposed to, those things are far more toxic and dangerous to us than potential chemicals in sunscreen. However, if you're somebody who just really likes to be careful with this kind of stuff, we are very lucky in that we have mineral based sunscreens. So if you are concerned about chemical based sunscreens, I would recommend whenever you're in the grocery store or shopping on Amazon, that you just type in mineral based sunscreens. There's plenty of them out there that are just pure zinc oxide. And you can't get much more natural or pure than that. So it kind of eliminates that risk or that concern surrounding sunscreen toxins. So.
And then another question is, what is the best way to get rid of blackheads?
Ooh, another great question. So, if the blackhead is easily accessible, come see me and I will gladly pop it for you. The other recommendation that I usually have is to see a licensed esthetician because they can kind of properly and safely extract your blackheads. Usually they steam your pores to kind of open it up, soften everything, and then they'll go in with medical grade tools to sort of safely remove blackheads without damaging your skin. Um, the other thing is if you're somebody who has like lots of little blackheads on the nose, there are a group of medications called retinols that can kind of help pull those blackheads out, sort of um, lessen the appearance of your pore size. Doesn't actually shrink your pores, but can kind of gently sort of exfoliate those blackheads, if you will. So, yeah, come see us here or see your esthetician if you have a good one. And yeah, we can give you some good treatment options for that. So.
What would you tell a teenage girl who pops their pimples?
Oh man. So I'm guilty. I am a big picker. Katie Keel, who's one of our nurse practitioners here, she has this great saying where she says, 90% of patients are pickers and 10% are liars. So, we all like to pick our skin. There are some people who have very good willpower, and I'm very, very envious of them. But when we feel lumps and bumps and icks on our skin, it's natural to really want to pick. But if you can resist the urge, that's the best thing to do. Really, my best advice to those teenagers that just want to pop all their pimples. I used to be one of those, and I can tell you, I now have some scarring on my cheeks, especially. That had I not been so aggressive about popping pimples so often, I think I wouldn't have today. So trying to resist the urge can help prevent scarring later on. So,
I have that same issue, and pimple patches really help me not pick.
yeah, that's a great, great tidbit.
And then, can people of color get skin cancer?
Yes, absolutely. So it is maybe not as common, although I would argue it could even be under-recognized in skin of color patients. But kind of going back to that, having more natural melanin, which is what gives your skin its color, having a little bit more of that natural protection does help prevent as much sun damage. But yes, I have found all types of skin cancer in skin of color patients. And yeah, so yeah, we'll go into that more. But
Okay. And then, is psoriasis just dry skin?
no, so that's another great question. So psoriasis is actually an autoimmune condition. I call it like an auto-inflammatory condition, which means you have to have something in your DNA that makes you prone to psoriasis. And then usually what happens is something along the way in the environment, be it a virus, a medication, kind of triggers that psoriasis pathway, if you will. And that's actually what starts this whole kind of inflammatory cascade, which can lead to actually psoriasis in many different shapes and forms. Psoriasis is not really even a true skin rash. It is a spectrum of conditions. So you can get psoriatic skin disease, which usually presents as these, we call them plaques. There are these flaky, scaly, dry areas that can affect the scalp, the skin. You can get psoriatic arthritis, which is inflammation of your joints, which can lead to tender, swollen, inflamed joints. We call it a sausage digit. If somebody comes in with a finger that's like twice the size of their other fingers, it can affect the nails. It can create all kinds of nail problems. It can even affect the GI tract and the cardiovascular system. So going back to one of our earlier questions about what are some of the advancements in my field, and I had mentioned, the advancements for psoriasis and eczema. There's a lot of time, research, and energy being pooled into Basically, that psoriasis is not just a skin problem. It can affect almost every organ system. We're kind of quickly discovering. So, yeah, great question.
Okay. And then why do I still break out even with a good skincare routine?
Yeah, so this is a great question. So acne is kind of multifactorial. There are a lot of different things that contribute to acne. So it's not always, in fact, it's rarely a cleanliness or a hygiene issue. People spend hundreds of dollars on skincare. You can be using the best products of the world and still get acne. And that's kind of more your genetics at play, to be totally transparent. I have spent quite a bit of time and energy trying to fix my skin, and my husband, I love him dearly, doesn't even wash his face, and he's never had a pimple in his life. So a lot of it does come down to your genetics, and you know, uh, oil production is a huge contributor to acne, and in my humble personal opinion, I think it's actually one of the major driving forces behind acne. Which is why medications like Accutane, also known as isotretinoin, work so well for acne because they really kind of shrink up those oil glands. So that's kind of, in my opinion, kind of the leading driver behind acne. But it is more complicated than that. It also has to do with how your body reacts to bacteria, how your body exfoliates dead skin cells. So it's kind of a multifactorial condition. So it's important that your skincare regimen kind of attacks all the pillars that contribute to acne. But even if you do everything right, again, you can thank your genetics. So
Would you say stress is a factor for breaking out in acne?
absolutely. So if you ask me, stress is the root of all evil. It doesn't just affect our internal organs or our mental psyche, it also certainly presents on the skin. In fact, there are conditions like one called prurigo nodularis, which is very much exacerbated by stress. And acne, especially for my teenagers out there, if you notice that you break out around the time of final exams or, starting a new job, anything like that, stress definitely can sort of wreak havoc on the skin. And my theory behind that is kind of fluctuation in hormone levels, which we know can be a driving force behind acne. So,
And then, do you have any over the counter recommendations or remedies for chronic athlete's foot with active ingredients in them?
yeah, so that's a great question. So, based on the conferences I've attended, the best over the counter products, there's two that I can recommend. For your actual skin, Lotrimin Ultra, specifically the Ultra version, can be very effective at cleaning up fungal infections on the body, on the feet. And then I always tell my patients who have toenail fungus or bad athlete's foot to get Tenactin shoe spray. And I usually recommend people spray the inside of all of their closed toed shoes at least once a week. And you really want to do that indefinitely. Because one of my kind of sayings that I've coined is that fungus is among us. It's very common, especially living in Florida. Fungus likes areas that are dark, warm, and wet. So, us Floridians, we sweat a lot, especially as the summer months approach. Trying to keep areas as clean and as dry as possible can certainly help prevent or lessen fungal infections. But those would be my two over the counter recommendations.
Great advice.
Yeah.
What should a patient expect during an annual skin exam?
Yeah, great question. I actually last year wrote an article about this because I'm very passionate when it comes to skin checks and doing them properly. So, whenever you come in for a skin exam, I always tell people undress down to your comfort level. But one of the jokes here at Midstate is that we don't have x ray vision. So, if you leave on your bra, your underwear, your shoes, your socks, those are all potential areas where you can have skin cancer. And believe it or not, I have found skin cancer in all of these areas. My preference is that you do fully undress. We do give you a gown to put on. So you're not totally exposed. And basically, we start at the top, we work our way down the front, we then stand you up and look at the back side. We only expose what we need while we're looking, and then we do cover you back up to help maintain some privacy. But in my opinion, it's really important we look at almost every inch of your skin because you just never know where a melanoma might be hiding. So,
And then someone asked, the skin on my heels becomes so dry that it is painful.
yes.
Should I put cream on them every night? And what would you recommend?
Yeah, so that's a great question. So, dry, cracked heels, we sometimes call this condition tylosis. It can be very, very common. Again, you can sometimes thank your genetics for this, other times it's just kind of normal wear and tear of life. I have found that one of the cheapest, easiest remedies for this is actually to douse those heels in something really thick and greasy, like a Vaseline, and then cover with an old pair of socks or something you don't really care if it gets messy. But something that's really dense and greasy, like a Vaseline, can be very hydrating for the skin. And it has all night to kind of soak in and sort of gently restore that skin barrier. But yeah, it can be quite painful and it is one of those chronic conditions. So I do find that long term treatment is needed. Um, but O'Keeffe's, Working Hands, those are some other kind of heavy duty moisturizers that are good throughout the day. But Vaseline seems to cure almost everything in dermatology. So I do recommend Vaseline and cover in with some socks at night. So, yeah.
Do you have any tips for someone who constantly picks their nails?
Ooh, nail picking. Yeah. So that kind of going back to our stress conversation, nail picking, can actually be a form of kind of OCD or sort of general expression of anxiety. We sort of all have our nervous habits, if you will. My wonderful grandfather, if he's on this listening, he will tell you that I twirl my hair incessantly. A habit he's tried to break me of before. Um, Minimal success. But nail picking or nail biting is another one of those things where it's a way that we can kind of release anxiety or stress. So I might make the argument that as long as you're not destroying your nails or you're not getting constant infections, you're not getting ill from it, that might be a healthier habit to pick up than smoking or something like that. However, I think if it's a habit that you want to break and you're determined to break, my best advice for some of my female patients getting like a gel polish put on or something thick where you really can't bite it and break it can be helpful. Or if it's, a younger kid or a gentleman, honestly, a physical barrier between you and your teeth or your other fingers can be helpful. So if you find that you do it when you're watching TV, put some gloves or socks on your hands so then you really can't get to it. But yeah, or band-aids, putting some sort of physical barrier between you and your nails or your teeth can be helpful. So,
And then, is it normal to lose hair in the shower every day?
yes, so it's normal to lose. The textbooks will tell you up to 100 hairs a day. I would even say more than that in some people. So yes, losing hair is normal. However, if you're noticing an increase in shedding, let's say you normally notice like maybe a small couple strands of hair, and all of a sudden you're pulling out like a handful. If you've undergone a stressful event in your life recently, that certainly could be an explanation. There is a type of hair loss called telogen effluvium, which is specifically a stress induced form of hair loss. It's actually something I have myself. And the good news about that is that it will kind of self resolve over 3 to 6 months. But I would say if you're progressively losing more and more hair and you're not having these periods of remission where it kind of goes back down to your normal or your baseline, that definitely requires a workup and that definitely warrants a visit to your dermatologist to kind of try to figure out what might be going on. So,
And then back to when we were talking about skincare,
yeah.
Is skin better over night cream better than tretinoin?
Yes, it is. Great question. So tretinoin has been around. I think it came out in like 1970 or something. It's kind of the OG of retinols. It's great for patients who are sort of balling on a budget, or maybe young teenagers who are just kind of getting into skincare. I think it has its place. But Alpharet is a very high end brand that has all the same benefits as a lower strength tretinoin. and then some. It's not drying or irritating the way that tretinoin is. It's actually very hydrating and moisturizing for the skin. And I think somebody had asked a question earlier about active ingredients or things that are actively stimulating our collagen, really actually waking up our skin cells. And this Alvaret cream is wonderful. It's what I use every single night. Kudos to our cosmetic team here. So, yeah.
And clearly it's doing a wonderful job.
Oh, thank you. Yes.
And then how dangerous is Florida sun exposure really?
Yeah. So we may have touched on something similar earlier, but yeah, the Florida sun, it's intense. We are, yes, Florida sun is very intense. And so that's why wearing a sunscreen of an SPF of 30 or higher and reapplying, every, in my opinion, 60 minutes or so, more often if you're really sweaty or if you're in water, is very important because it's going to block out not all the harmful UV radiation, but some of the most harmful UV rays that are known to lead to sun damage and skin cancers in the future. So, again, you can still get that nice tan even with sunscreen. So I would encourage you to enjoy the Florida sun, just be smart about it. Try to avoid those peak hours between 10 and 4 and wear your sunscreen. So,
What would you say is the weirdest thing patients mistake for skin cancer?
oh, that's a great question. I think the seborrheic keratoses, which we talked about, I should have gotten a photo of that. But those can be quite scary looking sometimes. Sometimes they can be very dark black. I think earlier I referred to them as like cauliflower-like lesions, but they can be quite scary. They can sort of pop up out of nowhere, and they can grow rapidly. So those often and rightfully so can be mistaken for skin cancers. So yeah, that was probably the most common thing. This is a great picture actually of what these seborrheic keratoses can look like. And as you can see, they can be dark and discolored. And if we go back to our A, B, C, D, E's and melanoma, which we talked about earlier, you can see these hit on a lot of those. They can be asymmetrical. They can have lots of colors. They can have weird borders and shapes to them. They can grow rapidly. So this is why, seeing a dermatology provider can be very helpful to really differentiate between what's benign and what's not.
Thank you.
Yeah.
If I am extremely dried out from using a retinol, what can I apply on my skin?
Yes. So our little plug, going back to the Alpharet product line, they will have. They actually are the only company that I know of that has actually formulated a retinol in a non-drying way. So if your budget allows, that would definitely be my recommendation. There's also a product called Bakuchiol, which is got a funny name, but that supposedly, I have my own opinions on this, but that supposedly is supposed to have all the same benefits of retinol. It's derived from a plant, but it's not supposed to be as irritating as retinol is. But if you are somebody, you have your tretinoin, your insurance covers it, you love it, you've been using it a long time, but your skin can never really get over that dry, peeling, irritated, feel from the retinol. The couple little tricks we have is you can either make sure you're only applying a very small amount, like a little chocolate chip or a pea size is enough for the entire face. This is another Katie Keel line that I'm going to steal, but she always used to tell patients to avoid the goatee area or kind of your lower face because this area in particular just never really becomes accustomed to the retinol. Retinol works very well for the forehead and the cheeks, though. Yeah, so my little tricks would be, limit how much you're using. Make sure you're not using a toothpaste strip. You just want to use a little dot. If it's too irritating, back off to using it every other night instead of every night. And then lastly, moisturizer. You can put your retinol on, followed by moisturizer. If that's still too drying, you can try mixing the two. And then if that's still too irritating, you can use what's called the sandwich method, where you do a layer of moisturizer, then your retinol, and then more moisturizer. Now be careful of that because some people, they can find it to be a little too heavy on their skin, and we don't want to end up clogging your pores, creating more problems. And I also always tell people whatever touches your skin first will have the highest absorption. So ideally, if we can get the medicine on first, that's going to be the best. But yeah, don't be afraid of your moisturizer. If you need it, you need it. Because even a retinol used a few times a week with moisturizer is going to be more effective than a retinol that's not used at all. So do what you need to do to get your medicine on. So yeah.
Do you have a good natural solution for dandruff?
That's a great question. So, I'll be honest, I really find that the over the counter dandruff medications work pretty well. Head and Shoulders is a very common brand, and that really is just one ingredient. Selsun Blue is another brand of something you can try. Tea tree oil, tar. Different oils like peppermint oil, I've even had a patient tell me has helped. So yeah, those are some over-the-counter medications that can certainly be tried. So
Thank you.
yeah.
What is one skin condition people wait too long to treat?
Yeah, so I think, the biggest thing is just making sure you're getting your regular skin checks, because there's just nothing more devastating than melanoma that goes undetected. Melanoma is very curable, very treatable when caught early. And the best way to catch it early is to go in for regular skin exams. So, yeah, I mean, I would really just say untreated skin cancers. Can be really the most devastating thing that people put off. And kind of going back to my point of, making sure you're fully undressing for your skin check. We all think we know what's going on our skin, but there's plenty of areas that we can't see, like the top of our scalp, our backs. So yeah, it's definitely important that you at least carve out time in your busy schedule once a year to make sure you're getting checked, because really these skin exams can save lives. So yeah.
Okay, and then what is one thing dermatologists wish everyone did?
Yeah, I mean, other than sunscreen and sun protection, getting your regular skin exams, those are kind of my biggest plugs. I think if you're doing that, you're off to a good start. So
Definitely. What, does not applying sunscreen when using a retinol cause acne to worsen?
that's a good question. I don't know the answer to that, but I do know, if you are acne prone, you tend to have more sensitive skin. And sunlight, can be inflammatory for people. So that certainly can kind of worsen acne. So, there's a reason we tell people use your retinol in the evening when you're not in the sun, because not all retinols, but some of them can be very photosensitizing. So, if you put it on at night where you're not being exposed to the sun, it kind of has time to work its magic. And then in the morning, you rinse off, apply your sunscreen. That's kind of the best way to go about it. So
As of now, I don't know if there's any other questions.
I think we're good. We got all the questions that you had
Great.
preloaded, and then I think everybody's questions have been answered here too.
cool. Yeah, if there's any last minute ones, feel free to plug in. But otherwise, thank you all so much for spending the last 45 minutes with me. This was truly a privilege, and I really enjoyed it. So, yeah, hope to see you guys again soon.
Thank you, Sierra. You did a great job and we learned so much.
Thank you, Kaylee.
Yes.